Hello, I'm Dr. Karl Knopf. It's my pleasure to share with you why I think fitness therapy needs to be part of an integral part of the continuum of care between physical therapy to personal training. Briefly, my background is I've been working in the field of adaptive fitness since the early 70s. In that regard, I've taught at Foothill College for almost 40 years. I did an internship at the VA hospital in Palo Alto as well as in San Francisco, and also worked in community colleges working with post-secondary adapted fitness, because what we often find is when someone gets discharged from physical therapy, there's no place for them to go. They're often discharged with an exercise program from a physical therapy department, and then given these exercises, and then these exercises just end up in a drawer at home, never being completed, or if performed at all, are often performed incorrectly, only exacerbating the underlying problem the client initially went there for. I have an undergraduate degree in kinesiology, exercise physiology. My master's is in adaptive fitness and biomechanics, and then my doctoral dissertation was on the post-secondary benefits of exercise for post-traumatic head injury. My master's thesis was on strength training for clients who were paraplegic and quadriplegic. And while both those sound pretty commonplace now, back 30, 40 years ago, we really didn't understand the benefits that could be derived from doing exercise or even strength training with people who were spinal cord injured or people who had head injuries. We really thought at that time, or at least the literature thought, that once someone had a head injury, that was as good as it was going to get. And I think part of my learning through the literature and research found some of that to be different. And then that just carried on over into other programs that we got involved with. I was an advisor for some NIH grants that looked at the benefits of exercise for people with arthritis. And again, the exercise really went to the point of how can we improve function? How can we improve the quality of life for these clients? And so through the years, I've written about 15 books, some used as textbooks, some are now used as for the lay audience as well. So I've also been shown in the New York Times, LA Times, etc. The Wall Street Journal did a nice piece on me many years ago. So I really think that fitness therapy is the future. I think that there needs to be a continuum of care where we blend therapy to fitness. And I think the fitness therapist lies right in the middle, that after someone's gone to physical therapy, they are handed off to someone who's trained and knowledgeable with the numerous chronic conditions that we see in aging. And then, if appropriate, they are then told to go and exercise independently or with a personal trainer. My major concern is that anybody can call themselves a personal trainer. In today's world, there's no standardization for who calls himself a personal trainer. If you have big arms and a skinny waist, you can call yourself a personal trainer. So what I really would like to see, that there be some standardization for fitness therapists, that they need to have some levels of competencies, and it really would be the physical therapist on top, the PT assistant, and then the PT aide, and then the fitness therapist, and then the personal trainer. There needs to be some type of progression so a client is informed who they're getting and what the skill set is. So that's how I see fitness therapy versus personal training versus physical therapy. They all are necessary, and I also think that the fitness therapist needs to have some of the tools of a personal trainer. They need to have the tools of a occupational therapist, maybe even a recreational therapist. So it really would be nice if the colleges and universities would start to develop such programs. I've been at Foothill College, as I said, for 40 years, and we started about 10, 15 years ago an adapted fitness certification, so that their student has to meet certain standards and criterias, and they can get an AA in adapted fitness, or they can get a certificate. And we've been very fortunate that all of our students have gotten gainful employment working with physical therapists or working out in the community with Stanford, such as their health improvement program as well. So I think the future really is we know that America is graying. We know that there are going to be concomitant disabilities that come with aging, and it is important that we have a group of trainers out there who can work in concert with the medical profession and know that they're going to get some quality of care. So I really think the future of physical therapy is here, but I do think with the restrictions of managed health care, people are not going to be able to go to physical therapy as long as they wish, and they need to be handed off to someone who's competent and knowledgeable about their condition. Thank you so much for your time.